if this pacemaker is also going to help you by giving a shock when there is an excessive cardiac action, so it has to do a process called as a defibrillation. That is being done by a device called as a defibrillator, which is the AICD, automated implantable cardioverter defibrillator. So in the CPT coding wise description of these codes, we have separate sections for pacemaker and defibrillator. But please understand, pacemaker performs a role only to increase the pacing of the heart, whereas the defibrillator helps to depress the pace of the heart. This pacemaker system is made up of two parts. One is the electrode, or otherwise we call that as a lead, and then as a pulse generator which has a battery inside. Whenever the patient comes for the change of a battery, it means a change of the pulse generator. So you should always know what is the encounter for this particular patient. Is the patient coming in for a placement of the device or for the removal of the device due to some mechanical disturbances or any infection or breakdown, or is he coming for the replacement of these devices? Okay, so based on that, our codes are going to be differ totally.